Mr. President, yesterday I came to the Senate floor and spoke on President Biden's vaccine mandate. I explained that I've now come to this chamber a total of 16 times and offered 12 different bills that would counteract, limit, or in one way or another restrain the vaccine mandate. I also explained that, unfortunately, each of these bills has been rejected by Democrats in the Senate. I've spoken to Utahns and folks from across the country who have expressed to me their frustration at moving goalposts and changing expectations in the middle of the pandemic. President Biden's vaccine mandate, which has been halted now by the U.S. Court of Appeals for the Fifth Circuit, happens to be among the latest attempts to force Americans to make health decisions under the threat not just of unemployment, but also under the threat of becoming unemployable. That's a taxing burden, Mr. President, for anyone to bear, anyone who's got kids at home, or if they don't have kids at home, if they're just supporting themselves. These days, all Americans are helping someone or something that they love, that they care about. And they ought to have the opportunity to do that. They ought not have their ability to make a living threatened by virtue of a distinct religious belief or a particular medical concern or a particular desire not to receive a particular treatment. And I'll reiterate here what I've said before. I've been vaccinated. My family's been vaccinated. I believe the vaccines are helping countless Americans be protected against the dangers of the COVID-19 virus. Just the same, there's a big difference between believing that the vaccine does good and receiving the vaccine on the one hand, and on the other hand saying that anyone who disagrees or who thinks that it's not right for them for one reason or another ought to be fired from their job and rendered unemployable as a result. That's very, very different. That's something that very few Americans would agree is right. In fact, according to a recent Axios poll, only 14% of Americans believe that someone who decides not to get the vaccine should be fired as a result of that decision. Now, in some lines of work, this sort of thing is already coming into play. For example, our military service members and frontline workers who sacrificed so much to care for and protect the American people during the pandemic are already being forced out of work. I've heard from many members of our armed services from Utah who are being discharged under less than honorable conditions and under conditions that are in no way, shape, or form appropriate in light of their many, many years of faithful, honorable service to this country. They're losing their jobs, and not just their jobs, but also their benefits, their dignity, their ability to serve further. And, you know, I've introduced and offered up a bill that would help them, but Democrats objected to that. On November 4th of this year, just a couple of weeks ago, the Centers for Medicare and Medicaid Services, known as CMS, imposed the requirement that all health care workers at facilities participating in Medicare and Medicaid be vaccinated by January 4th. This requirement, if it takes effect, will affect millions of Americans in tens of thousands of care centers across the nation. And unlike the mandate imposed by OSHA, which has now mercifully been stayed, at least for the pendency of the litigation pending in the U.S. Court of Appeals for the Fifth Circuit, this mandate, this particular mandate, gives no option for testing if someone has religious, moral, or medical objections to the vaccine. Now, let's just think about this on an individual level. There are nurses in this country who worked faithfully and, in fact, tirelessly throughout the pandemic without regard to their own circumstances, in some cases without regard to their own health, their own sanity, putting their lives at risk at times. They've gone to work caring for others during a pandemic, and they've saved lives in the process. They accepted the risk, and they were rightfully heralded as heroes for doing that. They still are heroes, and they still should be heralded as heroes. But many of these same nurses caught COVID at work and have recovered. They are, in fact, heroes. But now the Biden administration is giving them an extraordinary, and I would add extraordinarily cruel ultimatum, one that I don't think I've ever seen in government, one that I didn't ever expect I would see in government. Those very same doctors and nurses and other healthcare workers, the same people who we just appropriately described as heroes, can either get a medical procedure they don't want or lose their current employment and any future realistic prospect of employment. Let that sink in for a moment. What if this were you? What if this were your spouse or your child, someone you loved? What if this were your friend or your neighbor? The truth is, these people fit into all those categories. They're not our enemies. They're our friends, our neighbors, our family members, our loved ones. At a minimum, they are people who serve valiantly throughout a pandemic, and they should not be punished. They should be thanked. These heroes will be thanked for their service with a pink slip and a boot out the door as they become outcasts in the very profession that they've selflessly chosen, in the very profession for which they've spent a lot of money and a lot of time receiving training, and the very profession to which they've dedicated their lives. What a tragedy. What a needless, senseless tragedy. These, Mr. President, are not abstract anecdotes. This isn't just hypothetical speculation. No, not at all. I've heard from hundreds of Utahns who risk losing their employment if these vaccine mandates take effect. They're everyday Americans, they're good Americans, they're valiant Americans. Oftentimes they're struggling to make ends meet and to feed their families. They're our neighbors, our friends, our caretakers, our heroes. They deserve the respect that is necessarily implicit in the ability to make decisions for themselves, including these decisions for themselves. Additionally, it's, as a practical matter, just extremely foolish to be pushing healthcare professionals out of their jobs at the precise moment when our healthcare system is under such incredible strain. Hospitals are understaffed as it is. I mean, a lot of places are understaffed. Hospitals are particularly understaffed, even without this mandate. So requiring medical facilities to fire perfectly good doctors and nurses and technicians is only going to further strain our system and place more Americans at risk of serious harm. So today I'm offering my 13th bill in the effort to curb the vaccine mandates. My Respecting Our Frontline Workers Act would simply prohibit any federal agency from requiring that staff in healthcare facilities be vaccinated against COVID-19 as a condition of that facility being able to participate in Medicare, Medicaid, and CHIP. But this bill would provide certainty to our nation's healthcare heroes and honor the sacrifices that they've made to help Americans in need at a time when we were, as a country, facing great need. It will keep our healthcare system strong during what is still a really difficult time. This bill is the reasonable, compassionate answer to the current situation. I encourage my colleagues to support it. To that end, Mr. President, I ask unanimous consent that the Senate proceed to the immediate consideration of S3225, which is at the desk. I further ask that the bill be considered read a third time and passed, and that the motion to reconsider be considered read and be considered made and laid upon the table.
Is there objection?
Reserving the right to object.
Senator from Oregon.
Thank you, Mr. President. Mr. President and colleagues, sadly, this is the third time I've had to come to the Senate floor to object to Republican proposals dealing with far-fetched claims about vaccines. And today, I'm struck by one issue in particular because my background is working with senior citizens. I was the director of the Gray Panthers at home for almost 7 years. I ran the legal aid office for the elderly. I went into public service, Mr. President and colleagues, because of my passion for the cause of the elderly and trying to protect their well-being and keeping them safe. It's almost as if this unanimous consent request ignores the extraordinary human toll COVID-19 took on senior citizens in nursing homes across the country. Nearly 200,000 dead in nursing homes and other long-term care facilities since the beginning of the pandemic. Mothers and fathers, grandmothers and grandfathers. That's roughly 1 in 10 residents in those nursing facilities, according to an analysis of state and federal data by the COVID Tracking Project. How many of those senior citizens died alone without being able to spend their final hours or days with their loved ones? How many others, those fortunate enough to survive the pandemic, were still separated from their family members for months and months and months in 2020? We also know that the risks to nurses and doctors and EMTs were massive as well. One major investigation found that more than 3,600 healthcare workers died of COVID in the first year of the pandemic, the worst pandemic in a century that our country is still wrestling with as we speak. Nobody in this chamber should forget that. Just over the last week, there have been more than 1,000 COVID deaths per day. And in my view, it doesn't do any good to unnecessarily suppress access to highly effective vaccines while there's a deadly virus circulating and mutating around the country and around the world. Seniors who live in nursing homes and long-term care facilities are safer when the people around them get vaccinated. And I just hope that our colleagues will recognize the importance of that basic proposition. When Americans are vaccinated, they and the people around them, based overwhelmingly on the factual evidence, are less likely to die of COVID-19. And everybody ought to be interested in stopping this virus with these overwhelmingly effective vaccines. It shouldn't take a requirement to get healthcare workers to protect themselves and their patients. And as I close, I think, and again, I'm sad to have to come to the floor and get into this issue. But because of my background working with senior citizens, I think it is bad for senior citizens, bad for the elderly, to continue these frightening remarks about vaccines and vaccination policies. They've prolonged the pandemic. They've led to more infections and deaths. With respect to the proposal that's before the Senate, I simply don't believe senators should oppose policies that would keep America's elderly citizens safer after the pandemic has cost so many lives of America's senior citizens. Therefore, I object.
Mr. President.
Objection is heard. The senator from Utah.
Mr. President, I appreciate the thoughtful remarks from my friend and colleague, the distinguished senator from the state of Washington, from the state of Oregon. The senator from Oregon and I have spent a lot of time working on a number of issues together. He and I agree on a number of issues and have worked together to ensure the privacy of the American people and make sure that they're protected from an overreaching government, one that sometimes has intruded on them in violation of the letter of the spirit, if not also the letter of the Fourth Amendment. I remember when I first came to the Senate, the senator from Oregon took me to lunch, and we had a good chat. He introduced me to a lot of concepts in the Senate and has always been a good friend to me. I feel the need to respond to some of these issues. Yeah, I too, like my friend and colleague, the distinguished senator from Oregon, wish that we didn't have to come to the floor to discuss these things. I wish that it weren't necessary because I wish that we weren't even talking about firing people, about people losing their jobs, becoming unemployed and possibly unemployable as a result of a federal policy that refuses to allow people to make decisions on their own. Insofar as my friend, the senator from Oregon, describes the policy of firing people who refuse to get the vaccine as necessary to protect the elderly, I would respectfully submit that quite the opposite is true. We're actually imperiling those who might need medical treatment the most, including the sick and the elderly, insofar as we destabilize our healthcare workforce, which, make no mistake, this vaccine mandate does. It does that unquestionably. And remember that the CMS mandate that we're talking about, unlike the OSHA mandate, doesn't give any option to allow for testing. For example, if someone has a religious or a moral or a medical objection to the mandate. And so what this really is going to do is it's going to take a lot of people out of the healthcare workforce and sideline them. Yes, this is going to be devastating to those individuals. You're suddenly taking away their means of providing for their needs and those of their family. Absolutely devastating to them. And as I mentioned a minute ago, this is also a field in which they've invested a lot of time and money, sweat, blood, and tears into getting the education and the professional certifications necessary to work in a field that has a lot of requirements attached to it, with good reason. It's not good for anyone, least of all the elderly, to destabilize that same workforce. And so insofar as we're going to talk about what's better for the healthcare system, I just would respectfully reach the exact opposite conclusion of that proposed by my friend from Oregon. This just isn't going to make things better. It's going to make things worse. My friend from Oregon also described this approach, the approach that I'm taking of protecting the individual healthcare workers' right to make an appropriate decision without government interference, described that, and as I understood it, my other efforts to try to curb the more egregious impacts of the vaccine mandates imposed by the Biden administration is somehow unnecessarily suppressing access to the vaccine. I want to make very clear that that just is not accurate. I would state that as not at all consistent with what I'm doing. Not a single one of my proposals would suppress access to the vaccine. And each time I've come to the floor to talk about these things, I've made very clear I've been vaccinated. Every member of my family has been vaccinated. I've encouraged everyone I know to get the vaccine. The vaccine really is a medical miracle of sorts, and it's one that's protecting a lot of people. Now, not everyone agrees with me. But the fact that they don't agree with me, the fact that they don't agree with President Biden or anyone else in government, doesn't mean they should lose their job for it. But it sure as heck doesn't mean that firing them because they won't get the vaccine and then opposing the effort to force their firing would somehow amount to an act of suppressing access to the vaccine. That is a logical syllogism that just doesn't work. In no way, shape, or form would we be suppressing access to the vaccine if we liberated the American people from an overreaching executive who's insisting that people be fired if they don't agree with the president's officially sanctioned view on vaccines. My friend also noted that that people are safer when they get vaccinated, and I believe this is generally true. I don't think it's going to encourage more people to get vaccinated by telling them that they're going to get fired if they don't. Now, particularly with the subject matter we're covering today, where we're talking about the CMS end of the vaccine. These are people who work in healthcare. These are people who are highly educated in it, who have professional certifications, in many cases graduate degrees in healthcare. They can make their own informed decision as to what to do. Now, I tend to believe that people are generally safer when they get vaccinated, but that doesn't mean that firing them is the right thing to do. Look, finally, my friend from Oregon, and I don't use that term loosely, and he and I talk regularly. He was in my office earlier today, and we're talking about an upcoming game between the University of Utah and Oregon. When he refers to frightening remarks regarding the vaccine, I'm not sure what he's referring to. I hope he's not referring to remarks debating the merits or lack thereof of vaccine mandates. Nothing about these remarks that should strike anyone as frightening. What I think would be frightening would be if tens, if not hundreds of millions of Americans are threatened with getting fired based on their refusal to get the vaccine. Now, I don't think we'll ever reach a point where there are that many people who decide not to get vaccinated. It's certainly not going to be hundreds of millions of people declining to be vaccinated. But whatever the number is, it still doesn't make it right for the President of the United States to just decide arbitrarily that they either have to follow his medical advice and that of his administration or get fired. To choose between getting an undesired medical procedure or, on the other hand, losing their opportunity to put bread on the table for their children. It's not constitutional. It's not within Congress's power. Congress hasn't exercised that power, certainly hasn't given that power to the President of the United States. But regardless of all those statutory and constitutional arguments, this is a fundamentally morally flawed proposition that says everyone has to get this, and if you disagree, you will get fired. We will render you unemployed and unemployable. This is wrong, and it's especially wrong to do to our healthcare workers. Let's not do this. urge my friend and colleague from Oregon to reconsider. We can do better than this. The American people expect more. They demand better. And we need to listen to them. Thank you, Mr. President.
Senator from New Hampshire.
I have 14